Colorectal cancer is one that everyone knew that when you turned 50, you got a colonoscopy as like your 50th birthday gift. And no one really thought too much of it until last year. So in 2018, the American Cancer Society changed the recommendation. And they said that you should start doing that at age 45 instead of age 50. And that was a big deal. That was like in all the mainstream newspapers. That was a big enough deal. The issue with that is that recommendation is based on kind of a mathematical model. They are theorizing that if you screen that population, so patients 45 to 49, that you'll get a similar decrease in cancer, like we already have seen in patients that are 50 and older. The difference between the two groups is we've got 40 plus years of data that screening starting at 50 actually saves lives. Like that I can tell you, if you get your colonoscopy starting at 50, you're less likely to die of colorectal cancer. I don't have any of that evidence yet for 45 to 49. And it's probably not going to be here for 20 years just because it takes that long to see the effects. So that recommendation is, they call it a qualified recommendation. It's based on a hypothesis. They may very well be right. We just won't know for a while. And so because we are so evidence-based, in the 23rd edition, we didn't change the age for colonoscopy. So we still say start at 50, even though we do address the American Cancer Society's recommendations in the narrative part of the guideline. We didn't change the age because there's not any evidence behind it yet. Obviously, you don't do anything to a patient without informed consent, and you need to explain risks and benefits of everything that you do with any patient. This one's more cut and dried than prostate cancer. The evidence is pretty clear that if you screen for colorectal cancer, you're not going to die of colorectal cancer, or you're less likely to die of colorectal cancer. I guess where it would come in now is if you've got a 47-year-old guy that comes into your office and says, hey, I read this in the New England Journal, right? Not in the New England Journal, in the Wall Street Journal, and I'm supposed to get screened. I'm over 45. Now it becomes, you have to kind of have that conversation, especially if, I'm not sure the insurance companies have caught up with that yet. Insurance companies pay for a screening colonoscopy at 50. I don't know if they're doing it yet at 45. And so that would be where informed consent and discussion of risks and benefits would be more important. So similar to the prostate cancer, we do, like for instance, we do have a colonoscopy guideline. We have actually multiple guidelines that discuss colon cancer screening. But again, it's the evidence that's there, it's unbiased, it's transparent, and so it helps payers and providers make decisions.